Every morning, millions of people wake up and rub their eyes. They blink once. They blink twice. The world is still blurry. They think it is just tiredness. They think it will clear up in a few minutes. But for many people over 50, that blurry morning vision is not tiredness at all. It is something that has been quietly building inside their eyes for 20, even 30 years, and most of them have absolutely no idea it is happening. What if I told you that 6 seeds you can buy at any grocery store for just a few dollars, contain the exact compounds your eye lens needs to slow down this process? What if the answer to protecting your vision was not a prescription, not an expensive supplement, but something sitting right in the bulk aisle of your local store? That is exactly what I am going to show you today. My name is Dr. James Whitman. I have spent the last 3 decades of my career as a health researcher, and for most of that time, my focus has been one thing: helping men and women over 50 live longer, sharper, and more independent lives. I have studied thousands of patients. I have reviewed hundreds of clinical trials. And I have made it my life's work to translate complicated science into simple steps that real people can actually use every day. What I am sharing with you today is one of the most important things I have ever put together. So please, stay with me until the end. Let me start by telling you something that most eye doctors never explain to their patients. Your eye lens is made of proteins. These proteins were formed before you were even born. That is not a typo. The proteins inside your lens right now were created while you were still developing in the womb. And here is the critical part: your body never replaces them. The proteins you were born with are the same proteins you are using today. They need to last you your entire life. And over time, something starts to go wrong with them. As the years pass, those lens proteins begin to change. They start to clump together. When proteins clump, they stop being clear and transparent. They become cloudy. And when your lens becomes cloudy, light cannot pass through cleanly anymore. Instead of a sharp, crisp image landing on your retina, the light scatters. You get blur. You get halos around headlights at night. You get that foggy, washed-out feeling when you look at things in the distance. That is what a cataract actually is. It is not a film growing over your eye. It is your own lens proteins turning against you from the inside. Here is what makes this so difficult to catch early. The damage does not happen overnight. It builds slowly and silently over 2, sometimes 3 decades. You do not feel pain. There is no warning alarm. Your vision changes so gradually that your brain learns to compensate. You might think your glasses prescription has just changed. You might think the lighting in your house is getting worse. You might buy a brighter lamp and move on. Meanwhile, deep inside your lens, the process has already been going on for years. By the time most people get a cataract diagnosis, the damage has been accumulating since their 30s. Now, I want you to understand something important about why the eye lens is so uniquely vulnerable. Every other tissue in your body has a blood supply. Your heart, your liver, your skin. Blood brings nutrients in and carries waste out. But your eye lens has zero blood supply. None. It is completely isolated. There are no blood vessels running through it. The lens gets its nutrients from the fluid surrounding it, and that system becomes less and less efficient as you get older. This is a critical design limitation that makes your lens especially dependent on what you eat. The most important protective compound inside your lens is something called glutathione. Think of glutathione as your lens's personal bodyguard. It is an antioxidant, and it works directly inside the lens to keep those proteins clear and healthy. When glutathione levels are high, it neutralizes the oxidative stress that causes protein clumping. When glutathione levels drop, the damage begins. Young eyes are loaded with glutathione. That is why children have crystal clear lenses. But here is the problem. In your 50s, something structural starts to change inside the eye. A physical barrier begins to form between the outer part of your lens and the inner core. This barrier gradually cuts off the flow of glutathione to the deepest part of the lens, the core, which is the most vulnerable area. By the time you reach your 60s, the core of your lens is receiving very little glutathione protection at all. Without that protection, the proteins in the core are exposed. They break down, they clump, they begin to scatter light, and you start to notice it in your everyday vision without ever knowing what is causing it. This is exactly where diet comes in. And I want to be very clear about this, because there is a lot of confusion out there. I am not telling you that food can cure cataracts that have already fully formed. What I am telling you, and what the science strongly supports, is that what you eat has a direct and measurable impact on how fast this process happens. Glutathione loss and protein clumping are both influenced by oxidative stress. Oxidative stress is influenced by your diet. Specific antioxidants and specific fatty acids can significantly slow down this entire chain of events. Researchers have found something remarkable. If you could delay the onset of a cataract by just 10 years, not cure it, just push it back by a decade, you could cut the number of cataract surgeries in the world nearly in half. Think about what that means for your quality of life. 10 extra years of clear vision. 10 extra years of driving at night without halos. 10 extra years of reading your grandchildren's faces clearly without squinting. That is the power of what I am about to share with you, and it comes down to 6 seeds that you can find in any grocery store. Let us start with number 6 on the list: sesame seeds. These tiny seeds often get overlooked, but they do contain some genuinely useful compounds for eye health. They carry zinc, copper, and vitamin E, all of which support eye function in meaningful ways. Zinc in particular is important because it plays a role in the enzyme activity that protects the retina. Vitamin E is a fat-soluble antioxidant that intercepts oxidative damage before it reaches your lens proteins. So, on paper, sesame seeds sound excellent, but there is a catch that most people never hear about. Sesame seeds are high in something called phytic acid. Phytic acid is an anti-nutrient. It binds to minerals in your digestive tract and prevents your body from absorbing them properly. So even though sesame seeds contain zinc, if you eat them without any preparation, most of that zinc passes through you without ever reaching your eye tissue. The good news is that the fix is simple. Dry roast sesame seeds on medium heat for about 3 minutes. The heat breaks down the phytic acid without destroying the vitamins inside. Sesame seeds score a 3 out of 10 overall, not because they are harmful, but because they are foundational. They help prevent further decline, but they do not deliver the heavy-hitting compounds that your lens really needs. Number 5 on the list is pumpkin seeds. If you have ever eaten pumpkin seeds, you might have heard that they are good for your eyes. That is absolutely true. But again, there is more to the story. Pumpkin seeds contain lutein and zeaxanthin. These are carotenoids, and they are remarkable because they travel directly to the macula, the central part of your retina responsible for sharp, detailed vision. Your body uses them as a natural filter and antioxidant right inside the eye tissue itself. Pumpkin seeds also contain a significant amount of zinc, which supports the enzymes your retina depends on every day. The problem with pumpkin seeds is that they have an even higher phytic acid content than sesame seeds. If you eat them straight out of the bag, you are absorbing a fraction of their potential. The preparation method here requires more time, but it is worth it. Soak your pumpkin seeds overnight, for about 8 hours, in water with a squeeze of lemon juice. The acidity of the lemon, combined with the soaking process, dramatically reduces the phytic acid content. Then, drain them, rinse them, and they are ready. Pumpkin seeds score 4.5 out of 10. Better than sesame, but there are still more powerful options ahead. Number 4 is one that surprises a lot of people: hemp seeds. Now, when most people think about eye health, they think about antioxidants and vitamins. They do not immediately think about inflammation, but chronic inflammation is one of the quieter destroyers of eye tissue. Your retina is neural tissue. It is part of your nervous system. It is exquisitely sensitive to inflammatory damage over time. The kind of low-grade chronic inflammation that runs through the bodies of many people over 50 is silently wearing down retinal tissue year after year. One of the main drivers of this chronic inflammation is something called the omega-6 to omega-3 fatty acid ratio in your diet. In a healthy body, this ratio should be around 3 to 1 or 4 to 1. Modern diets, full of processed foods, vegetable oils, and packaged snacks, push this ratio to 15 or 20 to 1. That is a massive imbalance. And that imbalance drives inflammation throughout the entire body, including your eye tissue. Hemp seeds have a natural omega-6 to omega-3 ratio of approximately 3 to 1. That is closer to the ideal ratio than almost any other common seed you can buy. A meta-analysis reviewing 19 separate clinical trials showed that correcting this fatty acid ratio leads to measurable reductions in dry eye inflammation. Hemp seeds score 7.5 out of 10, and they require zero preparation. You can sprinkle them on food, stir them into yogurt, or eat them straight. Number 3 on the list is chia seeds. You have probably heard of chia seeds. They became very popular years ago, and the attention is justified, for the right reasons. Your retina is structurally built from a fatty acid called DHA. DHA makes up a significant portion of the cell membranes in your retinal tissue. Without adequate DHA, the structural integrity of your retina begins to degrade over time. Chia seeds are one of the richest plant-based sources of ALA, a fatty acid that your body can convert into DHA. Getting enough DHA through plant sources is a powerful way to support the physical structure of your retina. But here is the problem with chia seeds that almost no one talks about. The seeds have a hard outer shell. If you eat them whole, your digestive system largely cannot break through that shell. The beneficial fatty acids inside pass right through you without being absorbed. You are essentially decorating your yogurt with very expensive indigestible shells. The solution is simple, but requires one extra step. You need to grind your chia seeds fresh every morning. A basic coffee grinder takes about 10 seconds. Grinding breaks the shell and releases the fatty acids so your body can actually use them. You also need to eat them with a source of dietary fat, because ALA is fat-soluble. Pre-ground bags from the store are not a good shortcut. Once the seeds are ground, they oxidize quickly and lose their potency. Fresh grinding makes all the difference. Chia seeds score 8 out of 10. Number 2 on the list is freshly ground flaxseed paired with avocado. If chia seeds are powerful, flaxseed is extraordinary. Flaxseed has the highest concentration of ALA, plant-based omega-3, of any plant on Earth. 1 tablespoon of ground flaxseed delivers approximately 2,300 milligrams of omega-3 fatty acids. For comparison, chia delivers around 1,700 milligrams per tablespoon. That difference adds up significantly over weeks and months of daily use. A landmark study that followed 40,000 women tracked their dietary omega-3 intake and compared it to their rates of dry eye disease. Women with the highest intake of plant-based omega-3 had a significantly lower risk of developing dry eye syndrome. Dry eye is not just discomfort. Chronic dry eye causes micro-damage to the surface of the eye over time, and it accelerates the oxidative stress that damages the lens and retina. Reducing dry eye through nutrition is a meaningful way to protect your long-term vision. But, and this is non-negotiable, flaxseed must be paired with avocado. The omega-3 fatty acids in flaxseed are fat-soluble. Without a source of healthy fat, your absorption is minimal. Avocado provides the exact type of fat needed to unlock those nutrients. Grind the flaxseed fresh, eat it within 15 minutes, and pair it with avocado. Do not skip the avocado. Flaxseed scores 9 out of 10. Now we have arrived at number 1, the seed that scores a perfect 10. Sunflower seeds. paired with avocado and a squeeze of fresh lemon. Let me tell you why this combination is so powerful, because each element has a specific and irreplaceable role to play. Sunflower seeds contain more vitamin E per ounce than almost any other food you can buy at a grocery store. Vitamin E is a fat-soluble antioxidant, and it has a very specific job inside the eye. It positions itself inside the membrane of your lens fiber cells. When oxidative damage approaches, the kind of damage that causes protein clumping, vitamin E intercepts it. It acts as a shield right there inside the lens tissue itself. A major meta-analysis of multiple clinical studies found that higher dietary intake of vitamin E was significantly associated with reduced risk of developing cataracts. This is not a small or uncertain finding. The data is consistent and compelling. And here is what makes sunflower seeds especially practical. A 1-ounce serving costs under 85 cents. You do not need expensive supplements. You do not need a prescription. 1 ounce of raw sunflower seeds contains enough vitamin E to make a real difference in your daily antioxidant protection. But just like the fat-soluble nutrients in flaxseed and chia, vitamin E needs fat to be absorbed. That is where avocado comes in again. 1/4 of an avocado alongside your sunflower seeds provides the monounsaturated fat that unlocks vitamin E absorption and allows it to actually reach your eye tissue. But the lemon, the third element of this combination, is what elevates this pairing from good to exceptional. Vitamin E is what scientists call a sacrificial antioxidant. When it neutralizes a free radical and intercepts oxidative damage, the vitamin E molecule itself becomes inactive. It gets used up. Normally, that spent vitamin E would just be eliminated from your body. But vitamin C, found in abundance in fresh lemon juice, has the ability to regenerate spent vitamin E molecules and return them to active status. This means the vitamin E you absorb from your sunflower seeds can continue protecting your lens for hours longer than it otherwise would. Squeezing half a lemon over your seeds and avocado is not a flavor suggestion. It is a biochemical strategy. One important note: keep the dose to 1 ounce of sunflower seeds per day. Sunflower seeds are high in omega-6, and more is not better here. 1 ounce is the optimal amount. Now let me bring everything together into a daily protocol that is realistic and easy to follow. Every single morning, start with 1 ounce of raw sunflower seeds, 1/4 of an avocado, and squeeze half a lemon directly over the top. Eat this combination together. Do not eat the seeds separately and come back for the avocado later. Eat them as one combined serving so the fat and vitamin C are present during the same digestive window. For your daily omega-3 support, you have 2 options. You can add 2 tablespoons of hemp seeds to anything you are already eating. They have a mild, nutty flavor and require no preparation at all. Or you can grind fresh chia seeds and eat them with your meal, always paired with a fat source. On 3 to 4 days per week, add 2 tablespoons of freshly ground flaxseed on top of a 1/4 avocado and eat it within 15 minutes of grinding. This delivers the highest plant omega-3 dose available and directly supports the structural health of your retinal tissue. Once per week, eat a small handful of soaked pumpkin seeds, toss them on a salad, stir them into yogurt, or just eat them on their own after their overnight soak. I want to take a moment to talk about 3 mistakes that I see people make all the time when they start a nutrition protocol like this. These mistakes are common, they are easy to avoid, and they can completely undermine the results you are working toward. The first mistake is drinking coffee or tea within 90 minutes of eating these seeds. Coffee and tea contain tannins, compounds that bind to zinc and other minerals in your digestive tract and prevent absorption. This is especially important for the zinc in pumpkin seeds and sesame seeds. If you drink coffee first thing in the morning, eat your seeds at least 90 minutes after your last sip. The second mistake is eating your seeds in the evening. Fat-soluble nutrient absorption, particularly for vitamin E and omega-3 fatty acids, is significantly stronger in the morning when your digestive system is most active and responsive. Saving your seeds for a nighttime snack feels convenient, but it costs you a large percentage of the nutritional benefit. Morning is the right time for this protocol. The third mistake, and this one is the most important, is stopping after 2 weeks because you are not seeing dramatic results. Different compounds in these seeds work on different timelines. You may notice some relief from dry eye symptoms and morning fatigue within the first few days. That is real and meaningful. But lens protection, the deep work of slowing protein clumping inside the core of your eye, operates on a 90-day timeline minimum. The cellular changes are happening whether you can see them or not. Consistency is not optional. It is the entire strategy. Let me walk you through what you can realistically expect as you follow this protocol over time. In the first 1 to 3 days, many people notice that the tired, gritty feeling they usually have in their eyes by evening starts to ease. That discomfort is often related to dry eye, and the omega-3 correction from hemp seeds and flaxseed begins working relatively quickly. By the end of the first week, a large number of people report that their morning blurriness, that slow, foggy clearing after waking up, resolves faster than it used to. Their eyes seem to wake up more readily. Between 2 and 3 weeks in, you may notice that you are squinting less. Close-range vision, reading a menu, looking at your phone, reading a book, tends to feel slightly cleaner and less effortful. This is not your lens magically regenerating. It is your visual system working more efficiently because the inflammatory load on your eye tissue is decreasing. By the 90-day mark, the changes that people find most meaningful start to emerge. Reduced halos around headlights at night. Improved contrast, the ability to distinguish the edges of things more sharply. Slightly better color vibrancy. These are the signs that the deeper antioxidant work, the vitamin E, the glutathione-supporting nutrients, the omega-3 structural support, is beginning to reflect in how you actually see the world. I want to be honest with you, because I believe you deserve honesty more than false hope. This protocol will not reverse cataracts that have already significantly progressed. If your lens is already heavily clouded, surgery may still be the right path for you, and I encourage you to speak openly with your eye doctor. But what this protocol can do, and what the science genuinely supports, is slow the progression of early-stage lens cloudiness and meaningfully reduce the oxidative environment that drives the damage forward. For people in their 50s and early 60s who still have relatively clear lenses, starting this kind of nutritional support now is one of the most rational and evidence-backed things you can do for your long-term vision. Every one of the seeds I have described today is available at any grocery store. The total cost for the full daily protocol is under $2 per day. There are no proprietary blends. There is no subscription. There is no sales pitch. What I have given you today is the distillation of decades of research applied to something simple and practical that you can start doing tomorrow morning. The human body has an extraordinary capacity to defend itself when you give it the right raw materials. Your eyes are no different. I have worked with seniors for more than 30 years. I have sat across from people who lost their independence because their vision declined before anyone thought to tell them that food could matter. I have also watched people in their 70s with clear, sharp eyes who had been quietly supporting their vision through nutrition for decades, without ever knowing that was what they were doing. The difference between those two groups is not genetics, and it is not luck. Most of the time, it comes down to the small daily decisions that accumulate over years. You are here today, which means you are already making a different kind of decision. You are choosing to be informed. You are choosing to be proactive. And that is more powerful than you might realize. Start with the sunflower seeds tomorrow morning. Add the avocado and squeeze the lemon. Give it 90 days. Be consistent. Your lens has been working quietly inside your eye since before you were born. It deserves the support. I am Dr. James Whitman. Thank you for trusting me with your time and your health today. Share this with someone you love who needs to hear it. And take care of those eyes. They have to last you a lifetime.